Hello everyone. Today we are going to see what is diphtheria. I'm Ms. Jansi, tutor working at M College of Nursing. Objectives. At the end of the lecture, the listener will be able to define diphtheria, etiology of diphtheria, will state what is pathophysiology of diphtheria, the clinical manifestations, diagnosis, treatment of diphtheria, nursing care, and the complications of diphtheria in detail. Definition: an acute and highly contagious disease causing inflammation of mucous membrane caused by Corynebacterium diphtheriae. This also includes formation of false membrane in the throat which hinders breathing and swallowing. Etiology: the causative agent is Corynebacterium diphtheriae, a gram-positive non-spore forming bacteria. Transmission: it is spread through respiratory droplets from infected individuals or by contact with contaminated objects. Infection sites includes the upper respiratory tract, particularly the throat, tonsils and the larynx. Pathophysiology: Corynebacterium diphtheriae goes into the respiratory tract attached to the superficial layers of the skin or respiratory mucosa, forming pseudomembrane and relaxing strong polypeptide exotoxins which includes inflammatory reactions. Thereby, the lymph nodes swell and contain toxin, so the local tissue necrosis occurs and it leads to respiratory tract infection. What are the clinical manifestations? Respiratory symptoms include sore throat, fever, malaise, swollen glands around the neck, that is lymphadenopathy, thick greyish membrane over the tonsils, throat or nasal cavity, and difficulty to swallow and breathe. Systemic symptoms includes weakness or fatigue, myocarditis which can lead to arrhythmias or heart failure, nerve damage leading to weakness or paralysis, and cutaneous diphtheria is nothing but patches of grey membrane or on the skin lesions. Moving on to the clinical features in malaise, sore throat, fever, adherent grey pseudomembrane, you can see it here, and nasal ulcers might occur, obstruction of the larynx and the lower airway, difficulty to swallow. It leads to myocarditis, peripheral neuritis, and which finally leads to paralysis of the limbs. Diagnosis includes a thorough history and physical examination. Clinical examination includes the characteristic pseudomembrane and signs of upper respiratory infection, helps in diagnosing diphtheria. Culture and lab tests: sore throat or nasal samples are cultured to identify Corynebacterium diphtheriae. Electrocardiogram, that is ECG, this helps in detecting heart complications like myocarditis. Next, we'll move on to the treatment. Diphtheria antitoxin is available, antibiotics can be given, and supportive treatment must be given to treat this condition. Nursing care: it includes the respiratory support and airway management, so assess the respiratory function, monitor the patient's respiratory rate, depth and pattern, assess for signs of respiratory distress such as stridor, difficulty in breathing, cyanosis and nasal flaring. Frequently auscultate lung sounds to detect wheezing, crackles or signs of obstruction. Monitor oxygen saturation levels frequently. Ensure the airway pattern safe. Ensure the airway remains clear, especially if the patient shows signs of severe respiratory distress. Administer oxygen therapy if needed to maintain adequate oxygenation. Prepare for possible endotracheal intubation or tracheostomy if the airway is compromised due to the swelling. And suctioning. Suction may be necessary to remove secretions or pseudomembrane if it obstructs the airway at any cost. Moving on to the infection control and antimicrobial therapy. Administration of diphtheria antitoxin is important. So the first line treatment of diphtheria is diphtheria antitoxin, which neutralizes the diphtheria toxin. Antibiotic therapy can be given, and administration of antibiotics such as penicillin or erythromycin is prescribed to eradicate the bacterial infection. Isolation precautions also includes highly contagious, place the patient on droplet precautions to minimize the risk of transmission to others, and educate the family members about the need for isolation and limit the visitors. Also, monitoring and preventing the complications is essential factor. So here we have to maintain cardiac monitoring and neurological monitoring. Keeping that in mind, diphtheria toxin can affect the heart, leading to myocarditis. Monitor for signs of arrhythmias, heart failure and abnormal vital signs. Perform ECG monitoring to detect any signs of heart involvement. Neurological monitoring includes neuropathy, to rule out neuropathy, and the leading symptoms like paralysis or weakness must be monitored. Supportive care. As a nurse, we must also look into nutritional support, pain management and hydration status of the patient. So in nutritional state support, it includes provide nutritional support for the patient as swallowing may be painful or difficult due to the sore throat and pharyngeal swelling. Offer soft, cool, non-irritating foods and fluids. If oral intake is insufficient, consider IV fluids or nasogastric tube feeding. Pain management. Proper analgesic can be administered as per the doctor's prescription. Hydration includes ensure the adequate hydration either orally or via IV to support overall health and prevent the dehydration of the patient. Psychosocial support includes the family in concern. So, reassure the patient and the family members with early intervention. Patient and family education. Educate them regarding the vaccination and infection control. Vaccination. Educate the patient and their family about the importance of diphtheria vaccine to prevent further infections or future infections. Infection control. Teach the patient and family about the need for proper hand hygiene, covering the mouth and nose while coughing or sneezing and avoiding contact with others. Follow-up care includes encourage to come for the upcoming visits even after the infection has been fully treated, and to monitor for potential complications, for example myocarditis or nerve damage. Complication includes myocarditis. Myocarditis is nothing but the inflammation of the heart muscle, which can lead to heart failure or arrhythmias. Neuropathy, that is paralysis or weakness due to nerve involvement, which can affect the motor functions of the patient. Airway obstruction because of the thick pseudomembrane. This may obstruct the airway, leading to suffocation if not properly managed, and death if not treated promptly and effectively. Diphtheria can lead to respiratory failure, sepsis or organ failure. These are the complications of diphtheria. To conclude, nurses play a vital role in managing the patient's care, monitoring for complications, educating the family members and preventing the spread of this highly contagious disease. So close monitoring, early intervention and comprehensive approach to care and to keep improving the patient outcomes is essential. These are some of the references. Thank you.